when somebody calls to cancel the appointment, and nothing's set in stone. We just have to make our own judgment when to apply some of the rules that we have, when it's actually we need to apply them. We want to make sure our patients respect our time. At the same time, we don't want to be too harsh with our patients. We have to really listen to them and find out why they canceling the situation, and also look at the history, how many cancellations they previously had, if it's the first time or maybe it's a consecutive one, or there's notes in the system about the previous cancellations. You kind of have to look at the whole picture before making a decision on next steps, or how to handle the cancellation. But this is kind of like a guide. So we require, for any cancellations, we require a minimum of 48 hours. See, cancellations with more than 48-hour notice. So if they cancel, if they give us more than 48 hours notice, then it's just a regular cancellation. So the appointment can be rescheduled to another day without any penalty, basically. It's totally fine. Obviously, if you notice that the patient has previously canceled this 2 times or 3 times, and even that they are not short notice cancellations, they're just regular cancellations, it's maybe a time to bring up the deposit um, request for to book the next appointment, because obviously they just keep canceling, and we don't want people to just keep canceling their appointments. They need to book it when they really are able to come. In those situations, we can tell the patient, just, I noticed you had previous cancellations, and I know you canceling with the time that is allowed, but you previously has canceled already a few many times the same appointment. So we're gonna need a deposit for you to be able to book the next appointment. Um, so that's one case. But like I said, you need to understand the whole uh, situation before going that route. The next one could be multiple cancellations within 6 months. So a deposit is required to book any future appointments when a patient has multiple cancellations within 6 months. I go by every 6 months. I will say I look at a time frame every 6 months. If, for example, a patient canceled, 8 months ago, and then they call again and then cancel again, I only look at within 6 months. I think that's okay, unless you see a pattern. They keep canceling. You gotta make your own judgment, and kind of request the deposit when it's appropriate and needed accordingly. Uh, but I just look at on blocks of every 6 months. Cancellation within 48 hours or the same day. Now, the first cancellation, we understand, fine, no penalty. Uh, you can reschedule the appointment without any issues. Just obviously remind the patient that for future cancellations, please, if possible, give us 40-hour notice at least to make those cancellations, so they are aware of it. Um, if they have for second cancellations, a deposit is required to book future appointments. So if they have canceled before, let's say it was previously was another 48 hours cancellation, and now they do it as same day cancellation, these are two bad cancellations. So I will be expecting a deposit to reschedule that appointment. Obviously, you have to really also uh, take a look at the whole picture. If they cancel because of sickness, those are difficult to assess. I mean, like I said, look at the whole picture. If they have too many cancellations, and how long they've been with the office, what type of cancellation it is, if it's sickness, I mean, just at that point, just don't reschedule them. Tell them to call back when they feel better, usually 1 or 2 weeks. And if you actually do reschedule them because they want to be rescheduled because of sickness, then try to reschedule them like further down, like maybe in 3 or 4 weeks, or even more than a month from their original appointment. So it's kind of like a small penalty that is not a they're rescheduling it for next week, if possible, only if possible. Like I said, we're very flexible with our patients, but some of them we need to be a little more strict. No shows is definitely a really bad one. If somebody doesn't show up to the appointment, they have confirmed it, and they don't show up, definitely they require deposit automatically unless they can, you know, explain their situation. Sometimes there's death in the family, there's very major accidents, major situations that, yes, obviously by understanding what happened, we can, you know, override this decision of requesting a deposit automatically for next appointments. So it's very crucial to understand that what I mean, why is the reason to cancel an appointment? If it's just because they don't want to miss a soccer game or the swimming classes or piano lessons or anything like that, or just, you know, a meeting just came up, or anything that's more important than dentistry shouldn't be an excuse. Dentistry should be the most important of most situations. Is their healthcare. So make your own judgment. What's important, well, and what's not. A deposit is required if you need to ask for a deposit. It's $50 uh, to to book future appointments. The deposit will be lost if they, for example, they do two consecutive cancellations after the deposit. I mean, even with a deposit, if they call in advance and they reschedule, we might give them another chance to do that. But then on the second time, definitely they will lose the deposit. If they cancel within 48 hours or same day or no show, automatically they will lose the deposit. No questions asked. A deposit email template should be sent to the patient with a receipt after collecting the deposit for future reference. Okay. And also, any patient who has a problem with the deposit should be communicated to the manager for review. So, like I say, if you have any situations where you have somebody that really doesn't like the idea of putting a deposit, even knowing that it's their fault of canceling too many times, I would recommend you to always be on the side of the patient. Just explain that is not you asking for the deposit, is pretty much our process, and blame it to the computer, blame it to the system. Just say, well, the system keeps bringing up this window asking me to collect a deposit before booking the appointment, and that's why I'm requesting it, because you have multiple cancellations and the system kind of triggers a deposit request. So always try to blame it to the system. Don't blame it to the company. Don't say it's a policy, because it's not. Like I said, we'll make a decision accordingly. So just say the system is set up that way. Keep asking you for a deposit, and that will save the day usually. If they have a really big problem with the deposit, you can say, well, let me let me call you back. Let me talk to my manager. He's the only one that can override this window that's stopping you to book the appointment, and then obviously discuss it with me directly on the situation, and then I can make my decision and give you the go ahead to do exactly what I want you to do. If I want you to really collect the deposit, or maybe just give them another chance. Everything is case by case. Okay, so this is just a quick overview of cancellations. Like I said, uh, it depends each case, and also the most important, try to understand the reason they're canceling and how to proceed after that. Thank you.